So for SEP, Portuguese Nurses Union, and SRAM, Autonomous Region Union Nurses of Madeira, thank you for this interview. I've already congratulated you for your election, but on behalf of both presidents, I'd like to do it again.
Thank you.
So, a global citizen, a champion of equity, a nurse who leads. That is the way you present yourself to these elections. Tell us what that means.
Okay. Global citizen basically means that I look at the world, the people of the world, and the nurses of the world as one family. We don't get divided by borders. Illness doesn't know borders, health doesn't know borders, and I'm interested in the health and social well-being of people all over the world. A champion of equity means that we need to work as nurses day and night to make sure that everyone has the right for health care, and that means that everyone has a right for education, for housing, for income, because those are the things that will define how healthy we are. A nurse that leads, I spent my last over 30 years in various leadership positions, fighting for things, advocating, teaching, and moving forward. And becoming a president of ICN, it's the highest level of leadership one can aspire to, and here I am.
Talking about health and health providers is talking about nurse. We have answers, solutions, innovations, but still nurses are almost completely eliminated of visible nursing leadership. WHO is an example. What are you going to do about this?
You are absolutely right. I think we live in the 21st century where nurses better educated than ever before in the history of the world. But at the same time, I think many of us feel that we have less and less influence in the world. And I think a lot of it has to do with something very simple. We do not take our seat at tables of power, and we are waiting to be invited. Well, that's not the way. We have to demand to be at the table. We have to speak. Oftentimes, I see people get the seat, but they don't speak. Then it's a wasted opportunity. And my interest is to keep pushing nurses to understand that they can have very powerful impact on policy and government, but they have to be confident and they have to put themselves forward. It's the same principles with WHO. In each organization, you need different strategies, different messages, but we can't wait. It's be there and work on this constantly.
One of your promises is optimize the use of evidence and expertise to convince governments to improve healthcare policy. What do you mean by this, especially in those days we are facing a global financial crisis?
Practicing by the evidence will lead to quality care. Quality care is cost effective. If you don't practice by evidence and you do other things, it's just not going to build healthy people, and that costs money. So every time somebody comes back to an emergency room, or every time somebody is not able to practice their healthcare properly, it costs more money to the system, you know? If I have diabetes and you teach me how to cut my toenails properly and use the research, I will not have an amputation. If I have an amputation, it costs a lot of money. I am not able to go back to work. So evidence-based practice is cost-effective practice.
The differences between countries are a reality. Will not be easy put all together and all organizations. speaking in one voice. This is a huge challenge for you and the new board. What is your strategy to reach that?
You're absolutely right. There are a lot of differences, but I believe in finding the similarities. And if people really want to achieve global health and make sure that nursing is strong, we will figure it out. If people have other goals, then it's not going to work.
In this CNR, a lot of decisions have been taken. Do you think ICN will be more inclusiveness in 4 years? What will be a success for you?
Success for me will be that the member organizations and nurses all over the world feel that ICN is speaking out for those things that are important to us. To me, whether we have 50 million nurses or 13 million nurses, that's just numbers. Inclusiveness is how you speak on behalf of the global community and how you represent the global community. It will be a lot of hard work. I cannot do it alone. And I hope that lots of us will work together. And nurses are good. We care for the health of the people in the end of the day. Politics is politics, but we need to keep moving forward.
Being a Canadian nurse, living in Canada, and president of organizations with the headquarters in Geneva, how will you manage all of this?
For the last 30 years, I am a global citizen. I lived on planes, worked in different places, traveled all over the place. To me, oceans, continents, it's all one big world. And thank God today with the technology, we can do it in a very cost-effective way. The last job I had as the CEO and president of the Canadian Home Care Organization, the largest one, I had 50 offices across the country, and I still managed a very, very large organization. I learned how to work without being in the same building. So that comes easy to me. That's
no problem.
No problem.
Nurses in Portugal, as in almost every country of Europe, are facing very difficult times. Unemployment, reductions of work conditions, decrease of salaries, shortage, long working hours, mostly without being paid, increasing of working hours. What I see in the Portuguese unions, maybe from other countries too, because it's a global problem. What do you think we can do together to deal with this situation?
I would say that that's the biggest worry that weighs on my heart. And I had the opportunity to visit your country, and you feel in the air the stress. People are so stressed, so worried, and I don't see the end for the economic crisis. I think one of the things we have to do, we're not going to solve the economic problem of the world. I wish we could, but that's not going to happen through ICN. But we need to find ways to help our nurses to look after themselves, because the stress is enormous, and they looking after patients whose stress is enormous. And what we can do about it, I'm not 100% sure, but I think building awareness of the importance of nursing, making nurses feel that they are respected and valued. Fair pay is essential, but I know that your nurses go often months without being paid properly and so on. But we have to make sure that they feel respected and valued, and hopefully the economic situation will be over, and then things will continue to improve for nurses. In Canada, in the beginning of the 90s, we went through very, very, very difficult times financially, and there were a period of really going down. But when we came out of it, we kind of caught up. It troubles me to say those things because when you're in the middle of the trouble, you don't believe that there is going to be an end to it. But there will be an end to it. We just need to help each other to get to that finish line.
Well, we are sure that the crisis will end. The problem is what the nurses are feeling now, and you are right.
Absolutely.
Because we are in the front of all the problems, so it's not easy. But I think also that we can do some work with the labor organization.
Right.
So maybe that it's what another international organization
Absolutely.
that ICN can work with, trying to minimize this situation.
Absolutely. I hope when I get more into my orientation with ICN, I absolutely, next time I am in Geneva, I want to make sure that I meet with the leadership of ILO and have some of that conversations also within ICN, with the director responsible for socioeconomic. I need to understand what's her plan, and the board has to have a conversation to set direction on those issues. But the one other thing that we need to give nurses is hope.
Well, the last one, it's something that I don't know if you know, but today there are already some evidence that the poverty of the countries of the north and of Africa is moving to the countries of the Mediterranean. So, especially to these countries. This will have serious consequences to the citizens, like the access to health care, safety of the patients, and of course will have some implications on all the indicators that we have. Again, what we can do together and with the ICN to put this on the agenda of the governments.
So if you look at the Millennium Development Goals, there are 8 goals there, and the first one talks about poverty. So when people live in poverty, their health status is not as good as if they don't live in poverty. And we know that 75% of our health status is dependent on issues like poverty, education, and so on. So nurses and ICN and the unions have a very, very big responsibility to speak out and work with governments on making sure that we minimize poverty, minimize maternal child issues, and so on and so forth. And all those things, ICN has to be front and center and speak out on those things, communicate with governments, and make sure that that they are aware that this is not acceptable, and nurses will not support erosion of the health of people, whether it's children, whether it's families. It really is going to further erode the health system and the health status of communities and people.
So the new thing here is that European countries, this is a
New phenomenon.
A new phenomenon. So, I think most of the people can't understand yet what are going on and what becomes in the future.
Right.
So, I will say that we are in the beginning. So, it's time to start to make something, and that is the help that we are asking
Right.
for you, like as president of ICN, but of course to make things together, because I also think that we have to face these things together. Well,
But one of the things around those issues is that we need to encourage nurses to run for politics, because we need nurses also around political tables to speak out on those issues. And ICN and others need to go to economic forums like Davos and others and have a voice. And nurses need to be very vocal, hold their countries accountable on how they're going to build a robust economic society. Because unless countries figure out where their economic growth will come from, you're right, countries will slide into poverty, and that brings crime, that brings a lot of other things that countries wouldn't want.
So, finally, I'd like to ask you to say some words to the Portuguese nurses directly.
Okay, so my message to the Portuguese nurses is, I know the times are really, really, really difficult, and many of us hope that improvements will happen soon. And I, as the president of ICN, will do anything I can to speak out on the global floor on the issues of concern. I will work tirelessly to make sure that governments understand that their economic recovery will not happen without nurses. Nurses are essential to make sure that the economic improvement will happen. And I hope to celebrate better days for all of us.
Thank you.
Thank you.